Welcome to a presentation on systematic reviews and meta-analysis. I'm Dr. Prospero from the United Kingdom. The outline of the presentation will be on secondary research, systematic review, literature review, inclusion criteria, meta-analysis, combining individual trial data, heterogeneity, an example of a systematic review, meta-analysis with a research on ovarian ablation, forest plots, conclusion, and some questions. What are the types of secondary research? Secondary research, one type is narrative review, example, expert opinion. Another type is a systematic review or meta-analysis, which we'll be talking about. Secondary research answers a question, and for a narrative review, the question is usually a broad or scope or general question, and systematic review has focused and narrow question. The search methods also for narrative review are experts' familiarity with the literature, and for systematic review is usually a comprehensive defined search strategies. The appraisal of individual studies in narrative review is variable and mainly centered on expert opinion. For meta-analysis, it's a rigorous appraisal of inclusion and exclusion criteria. Synthesis of results in a narrative review is usually qualitative summary, but in systematic review is quantitative summary, and in meta-analysis, especially, they are statistical methods. The resources are less time-consuming in a narrative review and more time-consuming in meta-analysis or systematic review. The design and methods in a systematic review include inclusion and exclusion criteria, reviews of where the design and methods are defined, including these inclusion and exclusion criteria, and how trials will be identified. There's a written review protocol which includes all the relevant trials, and also a written review which is before the review commences. A systematic review seeks to include all relevant trials. The key principle is that as much as possible of the randomized evidence is identified and included in any analysis that are done. The systematic review differs from traditional form. This differs from the more traditional form of review, in which only a selected group of trials, which is probably biased in some way, is considered. Systematic review minimizes biases, also minimizes chance effects, and includes all trials, and the amount of data minimizes chance effects. How can literature search be done in a systematic review? Literature search by multiple databases, cross-checking reference lists, hand search, expert comments on missing studies, and identifying unpublished literature. What are the inclusion criteria for systematic review? The type of study design, the type of subjects, type of publications, language restrictions, types of interventions, and time frame for studies. What is meta-analysis? It's a statistical synthesis of the results from the included trials. A systematic review does not necessarily contain statistical synthesis, and this is the main difference between a meta-analysis and systematic review. The results of trials are combined in a meta-analysis. To be systematic, this still needs to attempt to include all relevant trials, since a meta-analysis will be non-systematic if, for example, the results were combined for only a small number of trials relevant to a review. Meta-analysis, when it is done, each trial is analyzed separately, and the overall result comes from combining these summary statistics. No assumptions are made about the patients in one trial being directly comparable with those in another, or about treatment differences being the same in each trial. What are the benefits of meta-analysis? To assess clinical effectiveness of interventions. Randomized controlled trials are most frequently combined studies. The summary data or individual patient data is used. Meta-analysis has 4 steps. First, literature search. Secondly, inclusion and exclusion criteria. Third, record data from individual studies. And fourth, statistical analysis of data. Combining individual trial data is based on sample size precision and external validity, so that it's generalizable, and also looking at the methodological quality. So there's a weighted average of results, and the weighting is the significance attached to each study. Heterogeneity refers to significant variation among individual studies in a sample. There's clinical heterogeneity, which is the same outcome measure but different interventions. Example, insight, which is not measurable. Secondly, there's methodological heterogeneity, which is not measurable. And thirdly, statistical heterogeneity, where different results are looked at. For example, harmful and beneficial results. Tests for statistical heterogeneity include the forest plot or blobogram, graphically or statistically, Labbe plot, Gilbreth plot, chi-square test, and Cochrane's Q. Significant heterogeneity occurs where there are clinical differences or methodological issues or early termination of trials or absolute versus relative risk or there is publication bias. Randomized controlled trials overview. This is a study on ovarian ablation in early breast cancer. Overview of the randomized trials, which are published in the Lancet. This is the ovarian ablation in early breast cancer overview of the randomized trials. And this is an example of a forest plot or globogram. That's the previous graph, which is as follows. Each trial represents one line of data, and there's also the trial name and the number of deaths, as well as women in the ovarian ablation control groups and statistical results. Forest plot or globogram. Area of the black square is the sample size. The horizontal line is a 95% confidence interval. The area of the black square is proportional to the amount of information contributed by each trial, that's the sample size. And the horizontal line through it represents the 95% confidence interval associated with the result of the trial. The diamonds in the forest plots are statistical subtotals and totals. The widths of the diamond are the 95% confidence interval, and the diamonds represent the statistical subtotal or totals. The position of the diamond lozenges depends upon whether the intervention rates favorably or not at the end of the meta-analysis. On the forest plot midline, a midline vertical line is often constructed to represent zero effect for the differences in outcome, and on either side lies the area favoring intervention A or B. When the blob or square lies on one side, this means that the outcome represented by that side is noted in that study. In conclusion, these methods of combining and reviewing data are an important means for assessing healthcare interventions. They are a complement to, not a replacement for, prospective randomized controlled trials. The most important part of the process is that all relevant trials are identified. This will help to obtain statistically accurate results. Now some time for group work. This is a graph which the group work will be based on. Take a good look. Which of the following best describes the graph? Is it a histogram, forest curve, globogram, or survival curve? The correct answer is globogram. This graph is a forest plot, also called globogram. Looking at this graph again for the next question. What type of study has been conducted? Is it a prospective study, randomized controlled trial, secondary research, or ecological study? The correct answer is secondary research. This graph is a forest plot which is a bubblegram. These graphs are produced in meta-analytic studies, which are secondary research. Question 3. Which of the following studies provides a result favoring mood stabilizers when compared to second-generation antipsychotics in the intervention carried out as per the forest plot? All studies, is it Baldwin et al., Segal et al., or Beck et al.? The correct answer is Baldwin et al. The results favoring atypicals are on the left side of the graph, and those favoring mood stabilizers are on the right side. Only Baldwin et al. Study favors the mood stabilizers. Even this study has confidence intervals overriding the 0 point. Looking back at the graph for the next question. Question 4. If p-value set for the presence of heterogeneity is p less than 0.1, which of the following regarding heterogeneity in the above forest plot is true? Heterogeneity cannot be calculated for single trials, or heterogeneity can be calculated for single trials. Either A or B, depending on the sample size, or none of the above. Correct answer is heterogeneity cannot be calculated for single trials. Heterogeneity refers to the degree to which individual studies differ from each other. So by definition, it cannot be calculated for a standalone trial as Bowen et al. And Segal et al. As p is greater than 0.1 in both olanzapine and second-generation antipsychotics, pooled data, options A and B, are incorrect. The graph again for the next question. Most precise results are noted for which of the following? Risperidone, quetiapine, pooled second-generation antipsychotics, or olanzapine pooled? The correct answer is the pooled second-generation antipsychotics. On visual inspection, the smaller horizontal lines represent all second-generation antipsychotics pooled and olanzapine pooled. On a closer look, one may find that the confidence limits are wider for the latter, around 40 points, compared to all second-generation antipsychotics pooled, where it is 33 points. Hence, pooled second-generation antipsychotics is the right answer. The graph again. Thank you for listening.